Hello everyone, this is Vicky and I'm going to talk about my project for elimination diets for Hashimoto's thyroiditis today. And I wanted to start with an introduction about Hashimoto's thyroiditis. It is the most common autoimmune disease occurring in about 5% of the population worldwide, and it's most often in women. There's a wide variety of symptoms that you can see listed here that it has associated with it. The standard treatment for this is synthetic thyroid hormone medication levothyroxine, which will usually maintain acceptable levels of circulating thyroid hormones for the patient. However, even though the hormone levels are adequate, the patients can still be symptomatic, which affects their quality of life. So how can we improve their quality of life? Well, diet is one way that we can do that. However, there's no standard dietary treatment recommendation for Hashimoto's thyroiditis currently. There are various elimination diets that are commonly recommended, such as a gluten-free diet, lactose-free diet, elimination of goitrogenic foods, and the autoimmune protocol diet, as well as calorie restriction. Studies for these diets show inconsistent and conflicting results. And what I found in my research was that there are many other conditions that occur along with Hashimoto's thyroiditis that can affect their dietary needs, such as celiac disease, non-celiac gluten sensitivity, lactose intolerance, food allergies and sensitivities, obesity, and micronutrient deficiencies. So because of this, it creates a complex situation for each patient, and a personalized dietary approach rather than a one-size-fits-all is needed. So the best way that I found to approach a personalized diet for these patients would be to use an autoimmune protocol diet. And this is commonly recommended for people with any type of autoimmune disorder or chronic inflammation. There's several pilot studies and case studies I found that show positive changes in thyroid hormone and antibody levels, body weight and BMI, inflammation levels, and all of the symptoms that were listed there. So the way this works is that it eliminates specific food groups that are known to be inflammatory for some people and then reintroduces them systematically to identify inflammation triggers for that specific person so that a personalized long-term diet can be created. The foods that don't trigger any response can be added back to the diet. Along with this diet, they also encourage consumption of nutrient-dense foods known to promote gut health and ease inflammation. Since you are eliminating so many foods, you want to make sure you're getting the necessary nutrients. They recommend lots of fruits and vegetables, teas and spices, bone broth, foods rich in mono and polyunsaturated fatty acids, poultry, seafood, and non-dairy fermented foods. Red meat is allowed, but it should be limited due to the saturated fat content. So to start off, the diet eliminates all grains, legumes, dairy, eggs, nuts and seeds, nightshade vegetables, highly processed foods, coffee, alcohol, and artificial sweeteners for 2 to 4 weeks. And then after that period, we can start adding in foods to find out which ones produce a provocative response and which ones don't. The interesting thing is that one of the studies used ELISA testing to identify specific antigens for each individual. And the most common antigens that they identified for these people that had Hashimoto's thyroiditis in their study group were wheat, barley, eggs, milk, yeast, corn, gluten, peanuts, almonds, shrimp, and soy. And what the rest of the research shows is that eliminating gluten can be beneficial for some patients with Hashimoto's thyroiditis, but not all, especially ones with celiac disease or non-celiac gluten sensitivity. They found eliminating dairy products is only helpful for patients who are lactose intolerant, and there wasn't any evidence to recommend avoiding goitrogenic foods, such as cruciferous vegetables, soy, and cassava, as long as they're not consumed in large amounts and there is not an iodine deficiency. along with that. Another consideration to think about along with the AIP diet is reduced calories. They found that even patients taking levothyroxine with thyroid hormone and antibody levels within normal ranges had difficulty maintaining a normalized body weight. And when they took an AIP diet in conjunction with a reduced calorie diet, they found that it was more effective at reducing weight than the reduced calorie diet alone, and it also improved thyroid hormone levels. There are some concerns to take into consideration when using an elimination diet. The elimination phase is very restrictive and not meant to be permanent. Some patients may be reluctant to add foods back in, though, because they feel better, but staying on this phase for an extended amount of time can result in nutrient deficiencies. So it's important to add back as many foods as possible to create the least restrictive diet and to increase the likelihood of patient compliance. And that is very important to have patient compliance because these highly restrictive diets can be very expensive, difficult to follow, and isolating. So it's important to provide good education and support and accountability along with the diet. And this is going to improve their adherence and their quality of life. In fact, one study reported a 95 to 100% adherence rate when they implemented an intensive health coaching program along with their AIP diet. In fact, the participants actually reported an enhanced quality of life with this diet, even though it was so restrictive. So there are a couple of websites that I've added here for resources to help you with supporting and implementing patients that are using an AIP diet. And then the last concern was micronutrient deficiencies. There are specific nutrients that you'll want to monitor, especially the ones that are involved directly in thyroid function. Any that are involved in specific conditions that might occur along with Hashimoto's, and also any deficiencies that might be associated with the foods that you end up eliminating. So there's more detail here that you can take a look at, but you want to make sure you're monitoring for all of that. So to summarize, basically, what I would recommend is an AIP diet to identify inflammatory foods for that personalized diet to transition to a long-term personalized anti-inflammatory diet. If weight management is an issue, reduce calories as well until goal weight is achieved. Monitor for nutrient deficiencies, specifically for iron, iodine, selenium, zinc, vitamin D, B vitamins, copper, and calcium. And lastly, pair it with a program to educate and support your patients and keep them accountable. I hope this was helpful. If you have any questions, please let me know in the discussion section. And thank you very much.